for Follow My Health, that is our patient portal. I'm going to go over some common questions, some helpful hints for you guys, contact information, and a quick look of what the patient sees on the mobile app. What is Follow My Health? We refer to it also as FMH. This is the patient portal that connects directly to Allscripts. It's utilized by many other healthcare organizations in our area, different primary care doctors and other referral groups as well. The patient will receive the invite to Follow My Health before every visit if they are not already connected. And then through the patient portal, the patient can review medical records in a secure environment, communicate privately with care teams, and then update health information, allergies, medications, that sort of thing. And they can also request prescription refills as needed. Once the patient makes the appointment, this is the email that they receive from us, letting them know step by step exactly how to get into our patient portal. Once they do log in, on our left-hand side here, this is what the sign-in page looks like. They just need to enter their username and their password. Once they have logged in, you'll see the image on the right. This is their homepage that the patient can access messages, My Health, appointments, documents, and they can also view other things such as bills and prescription renewals. Here's a few of the other pages that they can look at. They have an inbox, the My Health, which is where they put their allergies and medications. They could see any upcoming appointments, as well as their clinical summary notes, MRIs, or lab work. When a patient does start entering their medications and allergies, they do get this pop-up to let the patient know that whatever they enter into their portal is not going to be directly put into the EHR. It's just a good resource for them to bring to the office, and they can just give you their phone just so you could upload it versus it going directly from Follow My Health into the EHR. And then on the bottom right-hand side, there is the More tab, the 3 dots on the bottom. This lets them look at other options to look at their bills, renew the prescriptions, and they could log a journal if the doctor does an injection and they want to keep track of how they're doing. This is another useful way that they can use their portal. This is from the clinical side for what we see in the EHR. On the right-hand side, you'll see the Messages tab. You can see if a patient wants to update their pharmacy, any demographic information, and then as well as sending messages directly. Again, this stuff does not get automatically updated. We on our end the clinic side would have to update it manually in the EHR. Another way that you could see it as well is on the left-hand side. And once you're in the patient's chart, you'll see patient portal message from patient using Follow My Health. You can see it there as well. One thing that we want the clinics and the divisions to start doing is when a patient calls in regarding issues with Follow My Health, we want to make sure that everything is correct in the PM side of things. Make sure that the patient's name is spelled correctly, date of birth, address, and email address is all corrected. If the patient calls in looking for records to get uploaded, we want to make sure that the office is the ones that take care of uploading everything into the portal. One thing to keep note is if the doctor has not signed off on the office note yet, it will not upload automatically, but once the doctor does sign off, it should go into their account as long as the patient is set up prior to that appointment. One way to also get the patient connected is you could generate a dummy for an upcoming appointment, and then this will allow the patient to message directly to the care team. Do remind the patient to add the provider under My Providers once they're actually connected to our OCC. Some reminders regarding it, that Follow My Health is not Phreesia. They are two different programs that we work with. The patient will provide information into Phreesia, prior to their appointment. That information moves into the EHR, which then will be signed off by the provider. Again, once the provider does sign off, the clinical summaries and results will be uploaded into Follow My Health through the EHR. You can check in the EHR if the patient has a portal connected or not. It's in for the MA headline. You can see it in the upper left-hand side. It'll say web account that I have highlighted here with the teal. If they are not showing up, you can always just confirm the patient's email address as well in the PM. Sometimes numbers get flipped or we spelt their name wrong or something along those lines. And please also remind your providers that they can set up results for automatically publishing. This will cut down on some incoming phone calls to the office and the clinic. Under the caregiver options, the provider just needs to go to results and then publish to portal, and they'll make that say yes. That way, all the MRIs and lab work will go directly into that patient's portal. Here's the contacts that will be helpful for you guys. If the patient is having a hard time getting an invite code, if they need a password reset after trying to click on forget password, or if we need to recover a patient's login, you can send them to helpmeplease@occ-ortho.com. We will have every division having a super user for Follow My Health to help troubleshoot and streamline, take the patient up and running more efficiently versus sending them all over the place just to get an answer or to get help for the portal. And just a reminder for you guys too that this email address is only for Follow My Health. It's not for Allscripts problems or anything else along those lines. A lot of patient questions that we do receive through that email address is, what is my invite code? It's always their 4-year date of birth, so 1996 would be their full 4-digit login. What is the website? I have it listed right here. One of the other big common ones is, I already have a Follow My Health account through my primary care doctor. Can they add OCC to their existing account? And they absolutely can. Just remind them that when they do log in, they have to select that I have an existing account. They'll get 2 options when they first see their homepage. And then once they select that, they have to search for Orthopedic Centers of Colorado. They can't just type in OCC, but once they type the full name out, it should be able to pop up and it will add it to their existing account. More questions we get: can I update my medications, allergies, or make refill requests from the portal? They absolutely can, but again, remind them that it doesn't get transferred right over to the EHR. We will have to manually enter it when they do come in. And one more question is, why does Follow My Health not include my recent visits to my provider? It links it to it after signing up for Follow My Health. So they have to be a member prior to their appointment. If they sign up after their appointment, then it will not be uploaded automatically. We can always attach and push it through to their portal from our EHR. Well, some helpful hints for patients. We would like them to try to log in through Edge or Firefox. Chrome usually creates an issue when they get to the next portion. If they've already tried Edge and Firefox, then we do tell them to give Chrome a try, but usually we want them to start on a different web browser. We always notify them to clear their cache and delete their cookies and tell them to do Control-Shift and delete. Allscripts demographics need to match what the patient enters for Follow My Health, so we have to make sure that the name, date of birth, and address is all the same on both sides. And we always want them to sign up prior to their appointment. This QR code that you see here, this gets them to the login screen for Follow My Health, and we did send this out to the division leads yesterday, so that everybody has a copy of all these. That we should have them at the front desk and or in the clinic rooms as well. If they're in the waiting room, it's really good to ask them if they have a portal account. If not, give them the QR code, let them get logged in. That way, by the time they're done with their appointment, their office visit will then upload automatically to their Follow My Health account. And then these are the 2 other QR codes to get the app. The top one's for the iPhone and the bottom one is for Android. Again, these all went to the division leads yesterday. Just to go over a few things, just again, remember to confirm patients' demographics. That's one of our biggest hiccups for why they can't connect, verify name, date of birth, address, and email address. Upload the records as needed. Check for any unassigned office visit notes if that's what the patient is looking for. It might not be able to get uploaded until the doctor signs off on it. You can always generate that dummy appointment just to get the patient connected, and just remind the patient to add their provider under My Providers, and always that their invite code is their 4-digit year of birth. Are there any questions?
Becca, this is Christy. Can you hear me?
I can.
I think I have 2 questions. One of your slides talks about upload and push records as needed. Are we only looking for unsigned office visits? Is there a way to know what records have been uploaded, or?
I don't think we'll see it on the EHR side of what the patient already has. Normally when they call in like, hey, can I get my office note or my MRI from such and such a date? But I don't think there's a way to see it on our side, what they have on their portal.
So how do we upload something if they say they're looking for their MRI report?
Sure. So there's a specific spot within results that you can publish to the patient portal. It's just a tab within EHR in the results review screen that you can push automatically. And then any encounters that are signed off on after the patient creates a portal is automatically uploaded. So we may need to just double check and make sure that there's, if we're looking for a scan document or what type of document it is, the option presents a little bit differently. But the verbiage that you're looking for is published to patient portal.
Okay. And then my second question, I think it was item number 4. It says, can I update my medication allergies or make refill requests from the portal? So if they make a refill request, does that push through to the EHR or not?
Yeah, it will come over as a message to that care team. So it'll be on that right-hand side of the MA's main page. It'll be over there as just a portal message.
Okay.
Becca, could you go back to that slide? I think you have a screenshot of that.
Yeah. So it'll pop up right here under messages. And then it will be under your care team. So the MA should be connected to their care teams, and they'll just select that care team. It'll pop up in there that there's a message from the patient waiting from Follow My Health. That's where it should show up at.
Okay. Thank you.
And that's directed by the identifiers within the admin module. So if you need any help setting that up, those refill requests or RX requests are routed based on those identifiers.
Okay, thank you.
Looks like Des has a question.